have a crisis, not only in the United States, but around the world around healthcare. Universally, we need to decrease costs, increase quality, and increase access or reach. One of the ways we can do that is by using mobile technologies and shifting care away from just in the hospital to the community and to the individual. Shift from hospital-centric to user-centric or community-centric. We've done a lot of work over the years introducing products for remote patient monitoring and mobile devices. There's a few lessons that we've taken away from that. One is that the solutions have to be holistic. That is to say that it can't just be a piece of technology. It sounds funny from a technology provider, but you have to have a workflow that it integrates in. You have to have business models that make sense. Also, instead of just prescribing some medicine, what if a doctor were to also prescribe an application for the user to go home and understand better his or her disease and get some coaching about it? And also, lastly, how about prescribing some exercise for an individual, say someone who has diabetes, to make sure that they pick up their level of exercise and to actually monitor that and see what impact it's having on the individual. So that's one. Another one is embrace virtual technologies. We did a survey in the end of 2013, and over 70% people are willing to use remote patient monitoring and video type of technologies to engage and interact with their doctors. That's something that we should take advantage of. If you look at one of the hospital chains like Kaiser, they're going to almost 50% of where their care for such things as sending secure email to providers, doing prescription renewals is being done online now. So you're really starting to see some take-up of that as well.
In the U.S., we have gone through this grand experiment on meaningful use and incorporating electronic health records into hospitals and doctors' offices. And so for the first 2 years, these records were primarily on PCs, laptops, and notebooks. And now we're seeing a general movement to allowing electronic health records to be on mobile devices, whether they be mobile tablets or mobile phones, so that the doctors and clinical staff can have access to the patient's electronic health record while they're sitting there at the point of care to talk with the patients. So since the rules changed at the U.S. government level, we've seen a wide adoption of the mobile EHRs, which we think are really going to push the care and the health IT directly to that patient-doctor, patient-nurse interaction.
The key thing is to start with the line of business. What I mean by that is, in the good old days, most of the discussions that we used to hold with the decision makers were the IT managers or the CIOs. But gone are those days. The key people now are the doctors, the nurses, what we call line of business. And engaging them earlier on the discussion and also agreeing on what problem we will solve. It has to be either a clinical workflow or a patient engagement. So if we agree on those and if we involve the right decision makers at the right time, well before the project is designed, then I think you have 80% a chance your project will succeed.
IoT is definitely a buzzword and a hot topic, and healthcare is one of the biggest users of IoT. Intel is really a leader in this area. What we like to do is look at maybe wearables, and they can collect all kinds of data for a person. We categorize it as 3 types of wearables: person-to-person wearable, person-to-computer, and person as a computer. An example of a person-to-person wearable would be like a baby monitor, where you would measure a baby's respiration, heart rate, and be able to tell if they are, have some condition that needs attendance. So, for example, the SIDS disease, you'd be able to monitor them. Another example is, for example, put a sensor on someone's tooth so you can tell what they're eating, or say if they weren't supposed to be smoking but now they're smoking again, you can find that out. Or maybe they're not drinking enough so they're dehydrated. Intel recently purchased a company called Basis, which provides a smartwatch, which is a wearable providing a lot of information about vital signs. One of the big features it has is to measure your rest and your sleep, because quality of life is really dependent on your sleep, and if someone isn't sleeping well, it'd be good for them to be able to know that and know when they went out of sleep, and to advise them and coach them on how they could sleep better. Another company we've invested in is Sotera. It's really you can wear it on your sleeve. It's a wireless vital signs monitor. So in the hospital, the patient is free to move around the hospital, and they'll get continuous vital signs reading, which is important, for the doctor there. Really, when you talk about IoT and wearables, you need to look at it in the context of the entire end-to-end continuum, from the device at the edge to the gateway to the data center, and finally analytics, looking at those data and providing meaningful interpretation of the data. And so, for example, in healthcare, we like to say personalized computing, being able to consume data about you and provide some coaching that's specific to your needs and the data it's collecting about you.